President Biden pushed coronavirus vaccinations in North Carolina on Thursday. The pace of shots continues to slow despite nationwide efforts to boost uptake. More than 45% of the population is now fully vaccinated, and nearly 66% of adults have gotten at least one shot. That means that the nation would have to administer about 1 million first doses every day to reach President Biden's 4th of July goal, an unlikely situation. Meanwhile, a new analysis from the Associated Press found nearly all coronavirus deaths are now among unvaccinated people. It follows a claim by the head of the CDC that at this point, coronavirus deaths in this country are, quote, entirely preventable. Dr. Payal Patel joins me now. She's an infectious disease physician at the University of Michigan Medical School. Thank you for being here, Dr. Patel. The U.S. is now on average administering fewer than 300,000 first doses per day. About just a month ago, that number was around 800,000. Why is the pace of vaccinations continuing to slow so much, and how concerned are you by this?
Yeah, I think that there's always people who are excited about something. When the iPhone came out, there were people who wanted to get the iPhone right away. It's kind of a theory, right? That some people are going to be able, want to get the new thing right away. I know I was one of the first people to get the vaccine, was very excited about it. We're running out of that group of people, and we're coming into a new stage of people who may have a lot of questions, who are still trying to talk to maybe their primary care doctor, their friends, and that's the group of people that we're getting to. I will say that I'm very excited that about 85% of our senior citizens have been vaccinated. We know that they're the ones that are really at risk for severe disease. And though we won't get to that July 4th goal, we've gotten very, very close. And I know that we want to keep pushing through July 4th to keep getting those numbers up.
I think that was a helpful way of thinking about why the numbers are going down. But as you know, there are still new developments among variants. Officials in India, for example, are eyeing a new mutation of the contagious Delta variant. This one is called Delta Plus. What more can you tell us about this strain and what this mutation could signal?
Yeah, so as viruses mutate, we expect that there will continue to be variants. However, we've learned over this last year that the virus continues to get stronger and stronger. Luckily, the vaccine works. But for those who remain unvaccinated, they're dealing with a fitter virus than the virus that came out a year ago. And that's what we're seeing with the Delta variant. This new Delta Plus, we're going to learn a little bit more about, I'm sure, in upcoming weeks. But we're already dealing with the Delta variant here in the United States. Again, the vaccine seems to work and hold strong. So the best thing that you can do if you're worried about this is to get vaccinated and get those around you vaccinated.
Well, as you say, the original Delta variant, not even Delta Plus at this point, it's already rapidly spreading across the U.S. Tell us more about what's driving its spread. Can it be stopped? And as you were mentioning, that the vaccines that we have in this country are very effective, even in preventing the people getting the Delta variant or having severe cases of that. But we know that there's a huge difference between people who have gotten one shot of a 2-dose vaccine and both doses. What do you also have to say to people as we're talking about the Delta variant, Delta Plus, who have only gotten one shot of the vaccine?
Thank you so much for asking this question. What I want to say about the virus, first of all, the variant, the Delta variant, is that the way it's gotten stronger and kind of scarier is that it is more likely to cause infection. It's easier to transmit. And if you get infection, you're more likely to have worse symptoms. People are describing ear pain, maybe a sense of imbalance, more cough, more fevers, more likely to be hospitalized. So you definitely don't want to be dealing with this. We also know that unlike the original virus, the Delta variant is more likely to get you if you only got one of the 2 shots. So I would not consider yourself fully vaccinated until you've completed your 2 shots if it's a 2-shot series.
I want to talk to you about some new AP analysis as well. It found that the majority of all coronavirus deaths in the U.S. are now occurring in unvaccinated people. Earlier today in our editorial meeting, one of our producers was saying that people still see that there are occasionally people who are fully vaccinated that still get coronavirus, and they're using that as a reason not to get vaccinated themselves. But the reality of the situation is that only about 150 of more than 18,000 deaths in the U.S. in May were seen in people who were fully vaccinated. What more can you make out of these findings as we're hearing these numbers? And what do you also say to people who have heard, who have made these claims or have felt like maybe they shouldn't bother to get vaccinated then?
What you're saying totally lines up with what we're seeing in the hospital. We just are not seeing people who've been vaccinated come in very sick to the hospital. And if one was to ask themselves if they've been vaccinated, their family's been vaccinated, if others around them have truly been sick, it's so rare to break through that it's almost reportable news, right? While millions of people who've been vaccinated in the United States are doing just fine, going grocery shopping, getting out there again. So I would remember that the vaccines definitely work, and the best way to fight things like the Delta variant, the Delta plus variant, is going to be to keep increasing our rates. And what can we do? We can try to talk to our own friends and family that have those questions and show them that you're doing just fine after getting both shots of the vaccine.
One last question for you, Doctor. An NIH study released earlier this week found that for every confirmed coronavirus infection in the U.S., nearly 5 asymptomatic cases went undetected. Why is there still such a big gap? And how could the findings of this report potentially help with our response to health crises in the future?
This was a super interesting study. So as an infectious disease doctor, when, early on in the pandemic, when we first started getting patients into the hospital, we didn't even have enough tests. I would get a page every time someone needed to be tested for COVID. And so, there was a whole number of barriers for people to get testing. You couldn't figure out where to go. There weren't enough tests. This totally makes sense with what this study found, meaning that there were so many people who may not have been diagnosed, but did actually have COVID early on. And if you delve deeper into the study, you see that a lot of those people were young people. So again, I would remember coming out of this that young people are not immune to COVID. You can get sick. You would definitely want to protect yourself as possible. And the public health community will be using these results to think about not just COVID, but future pandemics.
Dr. Payal Patel, thank you so much for being here, and thank you for all that you do.
Thank you so much.